He knows I'm there. The time starts when he gets the paperwork. All right? You going to read first, or you going to bring her in first? Whatever you want.
I'll bring her in first.
Okay.
So, you may come in.
Hi.
Hi, I'm Titus. I'm the pharmacist here at the clinic. Can you just verify your name and date of birth, please?
I'm Tiffany Wynn.
And the date of birth?
What's 30 years ago? July 1, 84. Okay. All right.
Alright, if you can just have a seat, we're just going to go over your medical history with you.
And in this corner right here will be the patient information, so that he would have verified that. It would have matched. Okay.
And I just want to verify that you went to see Dr. Smirtis today?
Yeah, I saw Smirtlets 15 minutes ago.
Okay.
Boy, the nurses are here slow.
Yeah, I get that a lot. If you can just give me a moment, just to look over your chart, and then I'll get back to you.
Okay.
Okay. So I'll just think out loud, but what I'm looking at is chief complaint is of course not working, history present illness, runny nose, red itchy water eyes for months, senior minor for given or nasal cord, immunizations up to date, intermittent asthma, hypertension, current medications, acidophilus, Newport, no allergies, no tobacco, ethanol, or drugs. Adopted, and then for review systems, bottom of your eyes,
So he's checking to see if the data supports the chief complaint and all that. Now he's looking at the objective data, doing the same thing.
So blood pressure's a little high. Normal for allergies. CV's okay. Respiratory's okay. Deferred. As for the assessment plan, hypertension, based on the medication and the blood pressure. Turn next week for blood check will increase dose necessary. Not responding to Nasacort, change to Flonase. And here's prescription for the Flonase. Okay. So as I go back over here, I notice. So Tiffany, it says here have intermittent asthma. Are you taking anything for that?
No, I usually don't have to.
Okay. Well, so when do you get those asthma attacks? You know exactly when that happens?
When my nose blows up.
Okay, so when you get those allergies, that's when you get that intermittent asthma. Okay. For the medications, the Cinepril, Yaz, and Nasacort, can you tell me exactly the dose and how often you take those?
I take the lisinopril every morning, and I think they're 10 milligrams.
And then I'd be writing that on this current medication sheet. All right, and for the Yaz?
Oh, I stopped taking that.
Oh, okay. How come?
Well, we're trying to get pregnant.
Oh, okay. Noted. And for the Nasacort?
It seems like all the time. I started, I guess, 2 sprays 3-4 times a day. It just doesn't do anything. I mean, it's horrible. It's worthless.
All right, and how long have you been on it so far?
Oh, they gave it to me a week ago.
A week ago? Okay. All right, if you just give me a second, I'm going to call Dr. Smirtis about some little conflict here. Is that okay?
Sure.
All right.
Not Smirtlets.
All right, ring, ring.
Hello, Smirtlets.
Yeah, hi, this is Titus from the Longmore Clinic.
Hey, Titus, what's up?
Yeah, hi, I got a question regarding Tiffany Wen, date of birth, something 80, whatever.
Yeah, just saw her a few minutes ago. She was the nose, right?
Yeah, that was her. All right, so it says here she's taking lisinopril. She's no longer taking the Yaz because her and her husband are trying to get pregnant.
Oh, crap. Okay, great. I missed that. All right, anything else?
It also says that she wanted to switch to Nasacort. Thing is, she only has been on it for a week, so it hasn't really kicked in yet.
Okay, so what do you want to do?
If you'd like, we could probably keep her on it for another couple of weeks just to see if it starts working by then, and we'll give her the prescription if she wants to switch after that.
Okay, and what do you want to do about the other problem?
For the lisinopril, we can switch that to another antihypertensive, just not a teratogenic one.
Okay, that sounds reasonable. Do you need me to write it, or are you going to write it for me? right.
I'll switch it up for you.
Thank you so much. Bye-bye. Okay, so he did a drug therapy assessment as he went through this. All right? What did he find? She quit taking the Yaz. So what? She's trying to get pregnant. Well, that makes sense. The lisinopril is category X. Okay? Was it Wednesday afternoon's group that killed the baby?
I think so.
Might have been Tuesday. But one of the afternoons said, I don't see a problem. Okay? So, yeah, here's the problem. There's a drug therapy problem. We have a woman trying to get pregnant and she's on a category X drug. Now, if you're the pharmacy student that doesn't remember all this, you're going to have the computer next to you. If you do a drug interaction report, and I know if you do Micromedics' version, it'll tell you pregnancy, disease, drug or alcohol, cigarette interactions as well, okay, and common food interactions. So if you do a drug interaction report, you'll find it. How many of you see the pharmacist at your pharmacy do a drug interaction report? Why not? What's that? It's built into the software. You don't have to do an extra step for it. The problem here is if you're the prescriber, you don't have that database in front of you. Okay? You have a paper copy of a chart. Right? You're the pharmacist in a clinic like that. You don't have it. You need to go back and do it. Or you're the pharmacy student about to recommend a drug. Well, you're not in the system with the patient data, so you need to do that drug interaction check with your new recommendation in the mix. Otherwise, you're going to recommend the drug for their blood pressure that's a teratogen for them. Or you're going to recommend the medicine for their infection that has a drug interaction with their SSRI. Does that make sense? So he called the physician. Did he do SBAR? Did he say, here's the situation, here's the background, here's the assessment, here's my recommendation? No. Did he do it in that format? Yes. Okay? And now he's going to document, slide that other sheet up there. The other one. So he's going to write, he's going to do the current medications, and he's going to write a very quick note. You could use SOAP, you could use PHARM. Why don't we use PHARM for the example right now, because we've not used PHARM before. Findings. Patient on lisinopril quit taking Yaz. Lisinopril and trying to get pregnant. Lisinopril is teratogenic. Assessment. Patient should not be on teratogenic medicine. Sort of easy. Patient should not be on lisinopril. Okay. Recommendation. Change antihypertensive to, take a moment, pick something. It's not category X. Preferably not category D either. All right. Other, problem number 2. Patient using Nasacort inappropriately. Patient not given enough time for Nasacort to work. Plan. Inadequate drug trial. Recommendation. Teach patient to properly use Nasacort. Give a 3-week trial. Also give patient Flonase prescription with same instructions. If Nasacort fails, can switch to Flonase. But she's already bought the Nasacort. Buying the Flonase and doing it right just costs her money if the Nasacort will work. Does that make sense? So she documents the 2 problems. It's done. Okay? You could have done that with a SOAP format as well. Frankly, you could even done it with an SBAR format now that I think about it. Okay? But you need to do a good med history. Good med history. Then what he didn't ask was, are you on any other meds? So he found the extra med that's on the list carried over from automatic printing of the chart probably. Okay? And the physician did interview the patient, but he didn't ask about other meds. So he'd have gotten points for the things he did right, but he'd ask about other meds, and ibuprofen. She's using ibuprofen for knee pain, or she uses it for dysmenorrhea or something like that. You got to find all the meds. All right. So that's the one thing that he could have done better. If there's an allergy there, what's the reaction? This is functionally interview the patient, do a drug therapy assessment, find the problem from that, and fix it. Document it. Questions? 20 minutes. You can bring scratch paper, scut sheet, pencil, and a watch. And a watch. This is not a watch. Okay? It's not working anymore either. No. Let's see, what else? There'll be a computer in the room. People are having a little bit of a snit about Mac versus PC because I have more Macs than portable PCs. But if I put a mouse on it and it's in a browser,